Thank you, Mahin Beg, for sharing your views. My Health, My Right highlights the importance of international collaboration, solidarity, and resource mobilization to face health threats effectively, ensuring equitable access to knowledge about importance of self-health, vaccine, treatments, and all those tools which are essential for protecting the health rights of all individuals, regardless of their social, economic status, and geographical locations. I am honored to invite our first foreign delegate, Zikria Siddiqui, from United States of America to share his message.
Assalamu alaikum. I'm Zaki Siddiqui, a 10th grader from the Washington, D.C. area. As someone who spends a lot of time with patients in a rural setting in southern U.S., one of the most important aspects of communication between doctors and patients is relaying information about public health and safety. This includes information about how to prevent long-term diseases that are easily preventable with the right access to care. Today, I will be speaking to you about the importance of vaccines and disease prevention and how the process of preventative treatment begins with advocacy. Vaccines should be a human right because they are the most effective method of preventative treatment. The World Health Organization prevents around 3.5 to 5 million diseases a year by distributing and administering vaccines for over 20 life-threatening illnesses, including cervical cancer, tetanus, malaria, and hepatitis B. One main example that is relevant to Pakistan is polio. Since the 1920s, polio has become one of the most notorious contagious diseases in history and received a lot of attention in the U.S. because of President Franklin Roosevelt, who contracted the disease when he was 9. Because of the work of Dr. Jonas Salk, a vaccine was developed and first used in 1955. The World Health Organization says that Salk was committed to equitable access for his vaccine and did not patent the vaccine for himself. He never made $1 off of his work, and when asked who owned the patent, he said, "Well, the people, I would say. There is no patent. Could you patent the sun?" Despite the fact that it has been a long time since the distribution of the vaccine, the Pakistan Polio Eradication Program says that Pakistan and Afghanistan are the only 2 nations left that still suffer from the threat of polio. It is a very serious illness with symptoms including fever, fatigue, headache, vomiting, stiffness, joint pain, and in the worst cases, paralysis. Despite this, the eradication program, through the power of advocacy and working with organizations such as the Pakistan Cricket Board, have reduced the amount of polio cases in Pakistan by 99%. The reason that I mentioned this example of polio is to show the power that advocacy and public safety have in the community. Because of the work that the eradication program has done, millions of lives have been saved through strategies such as media coverage of the outbreaks, calling out certain cities and regions where outbreaks consistently occur, and using the second most popular sport in the world, cricket, to voice their concerns. Recently, the Multan Sultans of the Pakistan Super League partnered with the eradication program to increase attention to the topic. They brought in players such as star Pakistan wicketkeeper Mohammad Rizwan and all-rounder Iftikhar Ahmed as a strategy to draw concern and increase knowledge among the community. Access to healthcare and preventative treatment is a human right, but the process of preventative treatment begins with advocacy and bringing attention and knowledge to the community that might not usually receive it. That is why the work that the eradication program does is so important, because by using the assets in the community, such as the PSL, to voice their concerns, they are able to draw attention to the suffering that polio brings. Then, organizations such as Gavi and UNICEF are able to effectively administer vaccines. In fact, UNICEF's impact is massive, almost reaching half of the world's children and working towards eradicating diseases such as leashes, rubella, and hepatitis B. Healthcare is the most important human right, but it is of no use if people do not know where to receive it, what questions to ask, what diseases and illnesses are most prevalent among their community, and how to prevent getting long-term illnesses. Thank you for your time.
My Health, My Right encourages the mindset towards preventive healthcare and health education. By prioritizing preventative measures such as vaccinations, screenings, and lifestyle modifications, individuals can reduce the risk of illness and promote long-term well-being. It gives the knowledge and skills needed to make healthy choices and prevent diseases. I would like to call Mirha Imran from Fauji Foundation School, Hasilpur, to deliver her speech.
I am pleased to introduce myself as Mirha Imran from Class 7, studying in Fauji Foundation School, Hasilpur. I am honored here to speak on the topic My Health, My Right. Today, I stand before you with a solemn conviction. Good health is not a privilege but a fundamental right of every child. Yet in Pakistan, this right is often compromised, leaving many of our nation's children vulnerable to preventable illnesses and suffering. The health status of children in Pakistan is alarming. Malnutrition, lack of access to clean water and sanitation, inadequate healthcare services, and insufficient immunization coverage are just a few of the challenges they face. According to UNICEF, nearly 1 in 3 children in Pakistan suffers from stunted growth due to chronic malnutrition. This not only affects their physical development but also hamper their cognitive abilities and future prospects. In addition, infectious diseases such as polio, measles, and pneumonia continue to pose significant threats to our children's health. Despite efforts to eradicate polio, Pakistan remains one of the few countries where the virus still persists. Limited access to healthcare facilities, especially in rural areas, exacerbate these challenges. However, amidst these challenges, there is hope. There are practicable steps we can take to improve the health status of children in Pakistan. Firstly, we must prioritize nutrition, investing in programs that promote breastfeeding, provide micronutrient supplementation, and ensure access to nutritious food can significantly reduce the prevalence of malnutrition and its long-term consequences. Secondly, access to clean water and sanitation must be ensured by investing in infrastructure and promoting hygiene practices. We can prevent waterborne diseases and improve overall health outcomes for children. Thirdly, we must strengthen our healthcare system, particularly in underserved areas. This includes increasing the number of healthcare facilities, training healthcare workers, and providing essential medicines and vaccines free of cost. Furthermore, education and awareness play a crucial role. Parents, caregivers, and communities must be educated about the importance of vaccination, proper nutrition, and hygiene practices. Empowering women and girls, who often play a central role in caregiving, is essential for improving child health outcomes. Lastly, collaboration between government, civil society, and international organizations is key. By working together, we can leverage resources, expertise, and innovative solutions to address the multifaceted challenges facing children's health in Pakistan. In conclusion, ensuring good health for every child is not only a moral imperative but also a small investment in our nation's future. By prioritizing nutrition, improving access to healthcare and clean water, and promoting education and awareness, we can create a healthier and bright future for the children of Pakistan. Thank you.
The next speaker we have is Aisha Mustafa from Hamdard Public School, Lahore.
Ladies and gentlemen, Assalamu alaikum. I stand before you today to emphasize the fundamental aspect of our existence, our health, and the undeniable right we all possess to safeguard it. In a world where so many rights are contested and debated, the right of health should be indisputable. Yet, despite its immense importance, it remains an aspiration rather than a reality for too many people. Health is not merely an absence of illness. It's a complete state of physical, mental, and social well-being. So what does it mean for health to be a human right? It means every individual deserves access to quality healthcare, regardless of their background or circumstances. It means addressing not just medical needs, but also the social determinants of health. Factors like education, employment, housing, and clean water that profoundly impact well-being. It means prioritizing preventive care, early intervention, and holistic approaches to health that encompasses physical, mental, and social aspects of wellness. Furthermore, health is deeply intertwined with other human rights, such as the right to education. Therefore, ensuring access to healthcare goes hand in hand with addressing broader social determinants of health. Good health is not just a privilege reserved for a selected few. It is a basic human right. This principle is enshrined in numerous international declarations, such as by the Universal Declaration of Human Rights and agreements, emphasizing the universal nature of this right. However, despite this recognition, millions around the world are denied access to essential healthcare services, facing barriers such as poverty, discrimination, inadequate infrastructure, and political instability. This injustice perpetuates cycle of illness, suffering, and inequality, robbing countless individuals of their right to a healthy life. We must prioritize preventive measures and address the root causes of illness to promote healthier lifestyles. This includes promoting education on nutrition, hygiene, exercise, and disease prevention. By empowering individuals with the knowledge and resources to make informed choices about their health, we can prevent many illnesses before they occur, reducing the burden on healthcare systems and improving overall well-being. Moreover, recognizing health as a human right demands action. It requires governments to implement policies that ensures equitable access to the healthcare for all individuals. It calls for healthcare systems so that they prioritize affordability, accessibility, and quality of care. It necessitates investment in public health infrastructures, health education, and disease prevention initiatives. And it entails fostering a culture of health, literacy, empowerment, and community engagement. Our health is not just a privilege, it's a right, it's a treasure that must be protected, cherished, and advocated at all costs. So let us stand together in a solidarity, united by our shared commitment to health as a fundamental human right. Let us all play a role in safeguarding our own health and the health of those around us, whether it's advocating for our rights, promoting healthy behaviors, or supporting those in needs. Let us strive for a future where everyone, regardless of who they are or where they come from, can enjoy the highest attainable standard of health. Thank you.
Thank you, Aisha Mustafa. I request Aris Fatma from Fauji Foundation School, Hasselpur, to deliver her speech. She will deliver her speech in Urdu language.
अस्सलाम वालेकुम। मेरा नाम अरीस है और मैं जमात हश्तम में पढ़ती हूँ। मुझे इस बात पर बहुत फख्र है कि मुझे इस फॉर्म पर बात करने का मौका मिल रहा है। मेरा आज का उन्वान है मेरी सेहत मेरा हक। सेहत एक ऐसा लफ्ज है जो मुकम्मल जिस्मानी और ज़हनी हालत को बयान करता है। सेहत की देखभाल का निज़ाम किसी भी मुल्क के सबसे जरूरी सतूनों में से एक होता है। सेहत की देखभाल के निज़ाम का बुनियादी मकसद इस बात को यकीनी बनाना है कि हर शहरी को सेहत की बेहतरीन सहूलियात बड़वक्त और सस्ती मैसर हों। जनाबे आला, पाकिस्तान एक तरक्की पज़ीर मुल्क है। इसने हिंदुस्तान की तकसीम के बाद बरतानवी सेहत के निज़ाम को अमली तौर पर बरकरार रखा। इस निज़ाम को मौसी तरीके से अपनाने के लिए मुनासिब इंफ्रास्ट्रक्चर और माली मदद की जरूरत है। इस वक्त पाकिस्तान में सेहत की देखभाल के निज़ाम को कई मसाइल का सामना है। अस्पतालों में डॉक्टरों, नर्सों और पैरामेडिकल स्टाफ की शदीद कमी है। ज्यादातर जिंदगी बचाने वाली अद्वियात बहुत महंगी होने की वजह से लोगों की कुव्वते खरीद से बाहर हैं और सबसे बढ़कर निज़ाम सेहत पर लोगों को इत्मीनान नहीं है। पाकिस्तान में सेहत की देखभाल के निजाम में दो मतवाजी निजाम मौजूद हैं। एक सरकारी अस्पतालों पर मुश्तमिल है जबकि दूसरा निजी अस्पतालों पर मुश्तमिल है। सरकारी अस्पतालों में सहूलियात का फकदान है जबकि निजी अस्पतालों के अखराजात अदा करना अवाम के लिए मुमकिन नहीं। इसके अलावा तवील अरसे से मौत की बुनियादी वजूहात में वायरल हेपेटाइटिस, टीबी, मलेरिया, हैजा, टाइफाइड और डेंगू वगैरह शामिल हैं। 2024 तक सेहत के ये तमाम मसाइल शहरी आबादी में इजाफा, आलूदा पानी की फ्राहमी, नामुनासिब समाजी और इक्तिसादी हालात का नतीजा है, जिसकी सबसे बड़ी वजह पिछले 10 सालों में मजमूई घरेलू अखराजात का मामूली खर्च है, जो कि -0.5 से 0.8% तक है, जो कि आलमी अदारा सेहत की तजवीज करदा हद 6% से बहुत कम है। यही वजह है कि इस वक्त पाकिस्तान सेहत के शोबे में 195 मुमालिक में से 154 नंबर पर खड़ा है। मजीद बराम पाकिस्तान तरक्की याफ्ता मुमालिक में से हिफाजती टीके लगाने की शरह में बहुत पीछे है। यहाँ वैक्सीनेशन की कुल शरह 60% है, जिसके नतीजे में नौज़ायदा बच्चों की बहुत ज्यादा अमवात होती हैं। पाकिस्तान इक़वाम मुत्तहिदा के रुकन के तौर पर साल 2030 तक सेहत के मायन करदा मयार को हासिल करने के लिए कोशा है। सेहत की बुनियादी सहूलियात फराहम करने के लिए बहुत से प्रोग्रामों का उजरा किया गया, ताहम इन प्रोग्रामों को कामयाबी से चलाने के लिए मंसूबाबंदी, मुनासिब फंड्स की तकसीम और हुकूमत की गहरी दिलचस्पी दरकार है। सेहत के शोबे को बेहतर बनाना हर हुकूमत की अव्वलीन तरजीह होनी चाहिए। सेहत को कौमी तरक्की के बुनियादी स्तून के तौर पर रखना पाकिस्तान की तरक्की की तरफ पेशरफ्त के लिए बहुत जरूरी है। दूसरी सूरत में पाकिस्तान का निजाम सेहत खिते में मौजूद दीगर ममालिक का मुकाबला करने की बजाय अपनी बका की जंग जारी रखेगा। आपकी समातों का बेहद शुक्रिया। वस्सलाम।